they're going to tell you that it's, surgery is the number one cause of surgery. And if you can avoid it, it's just so smart.
One thing I always implement with every patient is stretching. No matter what we're doing, what their goals are, stretching is always included because it's the most neglected aspect when it comes to physical activity.
Go keto for a week and tell us how good you feel, right?
Yeah, there's the flip side.
Yeah, because I mean, even with me in particular, my brain function automatically, brain fog goes away. My joints are less achy. I'm quicker with many things, and it's just a big difference.
But I learned that in your small intestine, there's these CD34 stem cells. And if you're eating gluten, if you're drinking alcohol, if you're eating sugar, even some of the like nightshades can turn off these stem cell signaling properties. But it's a fast way that you can start having a lot of degeneration. And so,
especially in guy groups, you hear this a lot is like, oh, I'm too old to do that. Like, oh, my back's going to hurt for weeks after if I do that. That placebo effect of like, yes, you're going to experience pain because you just created that yourself just by having that mindset. All right, welcome everybody to the Health Accelerator Challenges. This is your host today, Kate Archibald, and yeah, really excited. We got a great big old fat treat for you guys today. We're going to be diving into some really cool stuff. We got some amazing special guests on from the East West team. So excited to dive in here. So before we dive in, let's talk a little bit about the challenge that we did last week. So Regan, what was the challenge that we had last week?
So last week, we had everybody looking at nutrition. So we talked nutrition and digestion and making sure that you're having like a day out of the week where you do more of a protein fast. We want you to get high protein, but we don't want that protein fermenting in your gut. It's kind of like having a dead animal rotting in your basement. All right, that's a bad analogy. Don't like erase that from your brain.
That's actually not a bad analogy. It sounds a little disgusting, but it's actually the truth, right?
Sometimes Kate smells like that, and that's what reminded me of it.
Got to watch out. Well, and I've also learned that the smell of your flatulence can also indicate if you're breaking down proteins appropriately or not. So I last week's challenge was to have really clean smelling farts. Is that what it was?
It was not the challenge, but we can go with that. Yes.
All right. Well, type into the chat box. Let us know how your flatulence was last week, and it'll be we'll have a great time with that. So what are we diving into today?
Today is going to be all about pain. And if there's one thing in life that sets us back, and if there's a condition that I've seen tear more people's lives apart, is chronic pain. And we've got Dr. Katie Anderson here. She's a chiropractic physician. She's done training in internal medicine. We've got Nikki Bott, who is our fitness advisor and pretty much runs the fitness department now and helps put together great protocol. She helps people rehab after they've had regenerative medicine with us. But the big thing we're going to touch on is pain. And pain is a 4-letter word for a reason. It really zaps energy. It shrinks our brain. It's one of the things that can age us and take us away from the things that we love faster than anything. And so I want, just before we kick it off, how many of you on this webinar have ever experienced a time in your life where you had significant levels of pain? Or maybe right now you have pain. And then if you plug in, like, what are the worst things that you'd say you've experienced? What are the worst things about having pain? And several of you are raising your hand, but Katie, Nikki, what would you say? That you guys have had pain, you're human. And so what's the biggest detriment of pain?
I mean, you're losing out on most things, social aspects of life. You're not able to go and do things that you would. Sometimes you're missing out on work. Sometimes you feel isolated and alone because you can't go out and do things. I mean, then mental issues are associated with that. So it can kind of spiral downward.
And
Yeah.
Katie, oh, go ahead,
Oh, sorry,
Nikki.
go ahead.
No, finish
Oh,
up. Yeah, I want to hear from you.
I was just gonna add to that it's like activities of daily living, what you're doing day in and day out, it kind of hinders that and makes it where you don't have the mobility and the function that you normally would have when you are in pain.
Yeah. Yeah. So, I mean, what it sounds like is that your quality of life just gets diminished very quickly. Katie, have you ever experienced a time in your life where you had significant amounts of pain or any issues you've had to deal with?
Yes, I absolutely have. I tore my LCL skiing. So it was a rough recovery, especially when you're a chiropractor and you need to walk around and stand and adjust patients. So it was pretty painful in the moment, and then the recovery was pretty rough. Yes.
Oh, so talk about that. What changed? Like you had to modify the way you moved your
Oh,
body?
absolutely. I mean, from anything from walking to sitting, I couldn't bend my knee, so my leg was extended at all times, and just my gait was off, and of course, putting more pressure on my left side than my right side, which then
Mhm.
affects any weight bearing joint all the way up the chain, and then to the back. I was starting to develop back problems. There were a lot of times where I couldn't adjust patients in certain positions, and so it modified my work in a big way.
Um, oh man. Yeah. And how's it now?
Much better now. Yes. So luckily, I worked at a clinic where we did regenerative treatment. Cade, thank you for that. And that really helped us out. So helped me out.
Great. Awesome. Nikki, how about you? Nikki just turned 17, so no. Uh, have you ever experienced any kind of like major injuries or setbacks?
Yeah, so in high school, volleyball actually, I tore my labrum in my shoulder, my left shoulder, and I'm left-handed. So that changed everything about how I approached volleyball. I had to do physical therapy for a long time, lots of rehab, strengthening that shoulder back up, and then found that I couldn't even serve anymore with my left hand. Had to learn how to serve with my right hand. And I still have some issues with my shoulder. It flares up a little bit, causes me some pain, but I really focus on mobility and just strengthening and stabilizing my shoulder to prevent that from becoming a bigger issue and preventing me from doing things I love.
Man. And so what did it impact the most outside of volleyball?
I think just strength training and resistance training because I did competitive strength training for a class in high school and I had to take almost a full semester off of doing that and
Yeah.
I atrophied so fast and wasn't able to lift weights anymore. So I think that was my biggest setback with that.
Isn't that frustrating when you get an injury? You're like, wait, no, now I can't. I was making progress, and then it's a setback, and it can be devastating. And that's why a lot of people get depressed when they have pain, is because the future gets really small. And I don't know if you guys have noticed this, but when you have high levels of pain, you can only focus on the pain, and so then all your options feel limited, and so you feel trapped. And I think we had some comments that come in, but I think Allison mentioned you can't sleep. It can definitely affect sleep. You probably noticed that on your shoulder, Nikki, trying to roll over on your shoulder. Also, it's like that hurts. Katie, you probably noticed that with your knee, just like a toothache, just throbbing.
Yes.
And then Cade's got back pain from motorcycle accident, 18 years old. Were you 18 when that happened? I didn't realize you're that young.
Yeah, it was like my freshman year of college. Or actually I would have been 19, sorry, because it was
Okay.
going in my sophomore year.
Yeah,
Yeah.
still young. That's when you were riding with Sierra, right? With Steve. Or no, you're on your own in Delta.
Yeah, I had just gone home and hopped on my dirt bike, cruising around the roads, And then there's this track that I used to always ride in the backyard there, and someone had taken a bulldozer through the middle of one of the hills. I was not aware that had happened. I went over went cruising up the hill, couldn't stop. I went over the bars, like bike landed on top of me.
Wow.
It was a little intense. Felt like someone was just stabbing me in the back. And yeah, all I can remember is like I was in the ER screaming, like trying to hit the morphine button, trying just like get this out of me. Yeah,
More morphine.
That was pretty much all the options I got too. Is like you can take some medication and you'll probably need surgery here pretty soon.
Wow.
Yeah.
Well, and I think everybody on here can attest to pain. And one thing that happens is I've learned, and I know, Katie, you've probably seen this as well as, and Nikki, but people learn to just live with pain and they give up. They just say, well, I've always had this pain, and they learn to walk in a certain way. And what would you say happens over time if people keep ignoring pain? What do you two see in some of the clients you work with?
Well, particularly with osteoarthritis is a great example, right? I mean, as the joint continues to degenerate, pain starts to set in. And then, of course, when pain sets in, then gait changes. And then, like an example with me, it throws everything off as far as mechanics. Then you start to develop aches, pains everywhere else in your body. But then you start taking, I'll just take an ibuprofen. It's fine. It really helps. It brings down the inflammation. And then before you know it, you're adding in more ibuprofen. And then before you know it, you have gut issues and GI bleeds because you're taking a lot of ibuprofen. And then you're on to heavier things. And then eventually you finally seek care. And the one thing that they really love to push, especially with osteoarthritis, is cortisone shots. And really, I mean, it may give you temporary relief, but the problem is that it degrades the joint even further. And so now you have a bigger problem.
Yeah. Well, and yeah, cortisone injections is like putting battery acid into the joint, and it deteriorates it fast, which then the next step is total knee replacement or hip replacement or whatever joint's damaged. At the retreat, we hosted a great retreat with Ben Greenfield last week. Katie was able to join us for it. And we had an orthopedic surgeon who came, and it was really nice to see his perspective. He's like, hey, I have some osteoarthritis in my knee, and I don't want to let this go any farther because I don't want to end up with plastic and metal in my body. And his big goal is to help his patients avoid getting those types of surgeries. And so I think, and even an orthopedic surgeon who's not motivated by money, they're going to tell you that surgery is the number one cause of surgery, and if you can avoid it, it's just so smart. And there's better technology. There's amazing things that we're seeing every single year, where the regenerative medicine gets better, the peptides get better, different treatments, knowledge around it gets better. And so, hopefully this podcast, you can share it with your friends, family, loved ones, because there's somebody out there who's like on the fence and they don't know where to turn, but they're tired of the pain, and they see surgery as the only option. And in some cases it's necessary, but in more cases than not, in the United States, we're operated on 3 times more than any other country. And so I think we get a little aggressive with the knife here. We're also twice as drugged as the next country. So we take twice the amount of prescription medications. So I think we're too focused on a disease care system and not focused on health. And that's why East West Health exists. Nikki, what are your thoughts on everything so far?
Yeah, I think Katie hit it right on the head, right? When you experience pain, it becomes either an upstream or a downstream effect, whether it's if you have your knee is causing pain, then all of a sudden you're walking funny, it affects your hip, it affects your low back, even your ankles down to your feet. So really centralizing in and focusing on that pain and going to the root cause of what's going on and kind of trying to resolve it essentially is the best approach, rather than just throwing some medication at it or just avoidance, surgeries, things like that. So I think really focusing on not only strengthening, but mobility and stretching is really important when it comes to pain. And with a lot of my patients, well, not a lot, every single one of the patients that I see, I make sure they have a good mobility program in place. A lot of patients already are being seen by personal trainers or have a good strength training routine or cardio routine. But one thing I always implement with every patient is stretching. No matter what we're doing, what their goals are, stretching is always included because it's the most neglected aspect when it comes to physical activity.
Wait, stretching's important?
And who would have thunk, right?
Man, it's crazy, isn't it? How and so many people are so inflexible. But the crazy thing is once you get more flexible, your strength increases. So you probably see this all the time where people are plateaued for years and then you get more mobility and all of a sudden they're like, hey, I'm having all these gains. I'm getting stronger. And I hear it from your clients all the time, Nikki. They're like, man, I'm getting stronger, I'm getting better. And Nikki's and it's not like you're having them work out more. You're just having them work out smarter and working on mobility.
Yep.
So if you looked at the number one way that people could prevent pain, Nikki, from a mobility perspective, what are like a couple things people could start doing with their body right now?
So as far as that goes, there's three main stretches that I include with everyone. Because for the most part, people are either experiencing like low back pain, which can be associated with like tighter hamstrings, and that
Mm.
posterior chain in a lot of people is chronically tight. We don't stretch enough, so it's really tight, hinders our function and our mobility. So I really focus on seated stretches so that there's no excuse, right? You can do it from a seated position anywhere. And more times than not, as Americans, we are sedentary for a good majority of our day. So the three stretches I really like to throw in there would be like a seated piriformis, where you're just sticking one leg out, pointing that toe to the sky, good posture, and a slight bend forward that really targets that hamstring and gives you a good stretch. Holding that anywhere from 10 to 30 seconds is like the most effective way to approach that. And then the next one would be seated piriformis to really target that piriformis. A lot of people have sciatic issues and that flares up. So that's another good one where we're just crossing one leg over the other. Again, good posture is key for all these stretches, and a slight bend forward. You'll feel that outside of your leg kind of light up, and that's where we're targeting. And then the third one that I always include is the seated adductor. So putting one leg up, you'd need obviously like a bench or something longer, whether it's your bed and putting one leg up and really targeting that inner thigh. So I think those are the three main stretches that I really like to focus on as far as like lower body goes, and focusing not only on the posterior chain, but lower body as a whole. And those three, if you do it twice daily, holding anywhere from 10 to 30 seconds, you'll see a lot of improvement.
Man, those are great. So the first one, legs extended out, you're stretching the hamstring essentially. Second one, you cross your leg, and that's where the piriformis, you're going to feel it kind of in the glute, the hips. And then the third one is where you're kind of sideways, you're stretching the inside of your leg, just so. And those are beautiful. And for those of you who have like maybe back pain, low back pain, herniated discs. I did a full body scan and discovered I had two herniated discs, and this was last year. And I was like, oh, that's crazy. And I do a lot of, mountain biking, skiing, snowboarding. And if I push it too hard, my low back will hurt. But I started doing the couch stretch. And the couch stretch has just like been a game changer. Well, I had some regenerative medicine in the area, and Amy just does a phenomenal job at that. But then I started doing couch stretch like every day. And what are your thoughts on couch stretch? Do you like that one, Nikki or Katie? Do you have any thoughts on that one?
I'll let Katie answer that one because I've been talking for a minute. So Katie, go ahead.
No, that's okay. As far as the couch stretch, you can probably speak better to that. But what I wanted to add in, or Regan, that you have at your facility is a spinal decompression table.
Oh, yeah.
So if somebody does have a disc herniation, a bulge, that is a tool that one could use to really help reabsorb that disc tissue. Essentially, the task of the spinal decompression table is to create a negative pressure within that disc pocket to help reabsorb that tissue. So that is something that can certainly be utilized if you're in that area.
I thought we just used that for interrogations.
That too.
Okay. Well, yeah, that's a great way. and couch stretch, maybe Nikki, tell us a little bit about why so many humans end up with tight hip flexors and why the couch stretch might also be a good one to add in.
So yeah, that just comes back to not focusing in on our mobility, doing it routinely, consistently. The physical activity guidelines recommend that we should be stretching every single day to be the most efficient, like that's the most efficient approach. A good approach is 2 to 3 times a week, but really focusing in on that 7 days a week. So with the tight hip flexor, obviously the couch stretch might be a little more difficult for a few people because it is getting in a kind of uncomfortable position. But I think that's a great one. Either that, if they can't get that back leg up in that couch stretch, I recommend like a half kneeling hip flexor because you can bend forward into that front leg, really get a good stretch on that hip flexor, and then even sit back on that back leg that's on the ground, and then you get a hamstring stretch in one. So it's kind of like a 2-in-1, kind of a flow like you'd see in a yoga movement, going into one move, back into another. So I think that's just a different variation on the couch stretch that I tend to utilize a little bit more, but I do really like the couch stretch as well.
It just feels kind of nice because I feel like I'm a yogi, even though I'm like the least flexible human that I've ever met. But and now I can get it where I can touch my back on a wall when I'm doing it, and it's made a huge difference. Because one of my goals this year is to touch the rim, and so Tristan's like, "Well, you should probably work on mobility," and then he has me jumping off high things and then just landing and then going back and jumping down. And then I'm doing a bunch of the athletic greatness courses, and it's been awesome. But that's a game changer. So stretching. So basically, you got to keep your body mobile if you don't want to have pain. So we're talking about ways of eradicating pain. One of the biggest ones is moving your body. Your joints are meant to move, and if you don't use it, you lose it. And that's where like osteoarthritis sets in. And I think, you've seen that for years, Katie. The second thing, if you look at the second main thing for pain, it's internal. So what are some of the things that you've seen internally, Katie, that are causing inflammation that are also creating chronic pain where it could be actually avoided?
Well, for one, our diet is a huge short source of systemic inflammation, right? So anything that we eat in terms of sugar or alcohol or fried foods, things that we know taste good but are bad for us. So those are very inflammatory. Those can create histamine release like no other. And then, of course, just even if a person has food sensitivities, right? That can cause systemic inflammation from that standpoint. And then just maybe even sometimes overuse of a joint that is arthritic, that's going to create more inflammation as well. I mean, there can be many causes.
Yeah. And so what are some of the biggest foods that people could eliminate right now, or the things in the diet, things in environment that are kind of low-hanging fruit?
Well, we always like to push, less than 1 gram of added sugar in diet. That's a big topic that we talk to our patients about all the time. Just any.
Let's stop there real quick because I dare, if you guys don't believe us on sugar, just go and eat a bunch of sugar, like all the time, eat a bunch of desserts, and tell us how your body feels after about a week. And then you'll be like, you'll feel wrecked. Okay,
or
sorry.
go keto. No, go keto for a week and tell us how good you feel, right?
Yeah, there's the flip side.
Yeah, because I mean, even with me in particular, my brain function automatically, brain fog goes away. My joints are less achy. I'm quicker with many things, and it's just a big difference.
Yeah. Other culprits. So sugar, no more than 1 gram. What else?
Yeah, but we often forget about carbs too, right? Breads, pastas, rices, and a lot of people think, well, I'm eating brown rice, I'm eating wild rice. Those things can actually have higher sugar content. We talk about gluten-free products. A lot of gluten-free products are made with rice flour, cassava flour. Those spike your blood sugar like crazy, which can really cause more inflammation than most. Fried foods, right? We love fried foods here, and that can really.
Fried foods aren't good for you?
Well, they're good. They can be
Hey,
good.
you lied to me. You told me they were healthy.
I I'm sorry.
And then alcohol, right? Alcohol
Oh, yeah. Darn it.
is
Yep.
very inflammatory for sure.
Yeah, it's crazy because I did a bunch of research on, what are the things that turn off your body's own stem cell production? Because one of the ways that we've learned is if you have healthy stem cell populations, there's a reason why a 3-year-old can fall down a flight of stairs, jump up and run away, and like as if nothing happened. 80-year-old falls down the stairs, and that may be the last step they took. And in a lot of cases, that's how, we pass away in our later years. And the interesting thing is it's our stem cell population that allows us to recover from these falls and allows us to have that plasticity and have the strength in our muscles. So, but I learned that in your small intestine, there's these CD34 stem cells. And if you're eating gluten, if you're drinking alcohol, if you're eating sugar, even some of the like nightshades can turn off these stem cell signaling properties. But it's a fast way that you can start having a lot of degeneration. And so I learned early on, we used to put, if you've read my book, Your Health Transformation, I have this liver cleanse in there that we used to do for our patients. And they would do the liver cleanse after 3 weeks, and their pain would be like 50% gone. It was amazing just getting their diet cleared up, what that can do. And so some other things, there's phenomenal things. So movement, diet are really important. When we look at peptides, Katie, what are some of the best peptides you've seen that will help create more mobility for people and help them recover from workouts?
Oh yeah. Well, of course, any of the peptides that help lower inflammation. So KVP is a very good one. BPC 157 body protective complex
Yeah.
really helps restore and repair old injuries. AOD is another good one. That's good for arthritic joints, right? Helping.
Isn't that crazy? Yeah, you can inject AOD right into the articulation and people have a really favorable response to it.
Yes.
There's other ones, if you
DHA, collagen synthesis. Yeah,
there you go.
yeah.
There's a killer for more flexibility for those of you who are really stiff, and that's thymosin beta 4. It's also helps navigate some of the DOMS or the delayed onset muscle soreness that can come when Nikki puts you through one of her workouts. So thymosin beta 4 is a lovely, lovely peptide. Nikki, any thoughts that you've got on peptides or supplementation or maybe creatine or let us have it.
Yeah, I think the one you just mentioned, the thymosin beta 4, I recently started using that, so injecting that every morning, and my recovery has improved significantly. I recently was just getting super sore after workouts, and it's not like I was going super hard. I was really focusing on mobility and stretching after a workout, doing some static stretching, but I was still just getting so unbelievably sore that it was just like hurting to walk. And I mean, yeah, I do push it really hard in the gym, but then I started using the thymosin beta 4 and it's a game changer. If you're lifting weights and engaging in resistance training and you don't have that in your protocol, you absolutely need it because it's fantastic.
That's awesome. We have one of our clients, and when he went to touch his toes, he was about 12 inches from the floor. And I was like, you need thymosin beta 4. And so we got him on thymosin beta 4. And within 2 weeks, he could touch the floor. And then he went off of it. And then his flexibility went away. And one of the side benefits is he could hit a golf ball about 300 yards when he started with us, which is phenomenal. It's a crazy amount. But he added 30 yards on, and he attributes it to thymosin beta 4, which is a really cool peptide. So, Katie, there's a lot that goes on with pain. I think from an internal perspective, one of the things that I've looked at over the years is what it does to the brain. And I don't know if you've done much research on this or if you've seen the atrophy of brains. Have you seen some of those studies on MRIs?
I have
Okay,
not.
well, this will be fascinating for you. But what they found is that people who have chronic low back pain, their brain is 7 years older than they are chronologically. So if you want a really old brain that doesn't think very well, then just have chronic low back pain and don't do anything about it. And it's the fastest route to Alzheimer's and dementia, and then you can just forget about your life. So
I would imagine probably shrinking the hippocampus, right? And the pain response, that's a big one. Yeah.
Yeah, movement area. Yeah, it's and you think about pain and you're like, well, why is that? But it makes a lot of sense because one of the fastest ways to create neuroplasticity or to help your brain heal is movement, right? Because our brain has to coordinate all these movements. And if you think about like 75% of our brain is wired for vision and movement. And so if you stop moving, then you're cutting off like almost 3/4 of your brain's capacity. I mean, it's crazy. Our brain's not just for thinking, it's for moving. And so that's one thing, one reason to say, hey, take your pain seriously. The second thing that I think is very interesting is they did a study and they took people who had half the participants, it was like 300 people, half of them had low back pain, the other half had no back pain. And they did MRIs on it. And what they found is in the half that had no back pain, 50% of them had like bulging disc or degenerative disc disease or some type of issue in their back that was asymptomatic. In the other group, people who had like massive back pain and sciatica, all these things, half of them had normal MRIs and the other half had, messed up MRIs. So pain goes beyond just what the physical structure shows. And I've seen this in people who have like phantom limb syndrome, where I have a patient who had his arm blown off in Afghanistan. And he was always like, that's so weird. I have hand pain, but I don't have a hand. But pain starts in the brain and it goes much deeper. But Katie, what do you think? What are your thoughts on some of those studies? Or Nikki, chime in, Kate, anybody? But
well, I think they're fascinating because, to your point, I think for some people and what I've experienced, I think it can also become their identity, right? Because it's affecting so much of their lives that now that's all they can talk about. That, well, I can't do this because of my pain, and then it's like they associate anything in their life with their pain.
Totally.
Yeah.
Everybody, you kind of get used to being treated like being a little bit pampered at home. And I usually just tell my wife I'm in a lot of pain when she wants me to when there's a project around the house. I'm like, oh, you have no idea. And now I have this full body scan and I'm like, see these herniated discs? Like I could really get injured if I pick this. No.
Meanwhile, your honey-do list is getting longer.
She's like, well, you just got off your mountain bike and then you're in the gym lifting weights this morning. I'm kind of confused.
Yeah.
But yeah, no, I'm joking. But
selective.
Yeah. So people do. I mean, you can literally you can frame your whole life around this idea that you're going to have pain. And so when we look at that study on the images, just because your images or a doctor tells you you're never going to be out of pain, it's just not true. Pain is so much more complex. Nobody understands all the mechanisms behind pain. I can promise you that. We don't understand it, but we do know some ways of turning it down. And but Nikki, what are your thoughts on the images or some of the conversations around pain today?
Yeah, I think it's really interesting, right? Knowing that it stems deeper than, oh, I just have pain here, that it also affects the brain. It's even more reason for you to really get a resolve on that and see some improvement and really target it and go after the rehab process to get out of pain, whether that's regenerative therapy, whether that's physical therapy, chiropractic, anything, or even just as free as stretching each day. I think it's really cool to see that it's not just one centralized location. You're going to have issues upper, lower, wherever you have pain. It's going to stem to your whole body, especially the brain. And I think that's really fascinating to hear.
Yeah.
Yeah, I think one thing that I see is interesting and kind of what you brought up, Regan, is when you're talking to like friends or anyone, especially in guy groups, you hear this a lot, is like, oh, I'm too old to do that. Like, oh, my back's gonna hurt for weeks after if I do that. And I mindsets and thought processes like that, like it almost it's that that placebo effect of like, yes, you're going to experience pain because you just you just created that yourself, just by having that mindset. And so I think also the thought process around pain, and obviously there's a lot that goes into the preparation and the physical ability before you go, and whether it's you're going mountain biking, snowboarding, or whatever, and you're expecting to be sore or get injured or whatever after that. There's a lot of preparation that goes in before it, but I think if we have the right mindset around it, we're actually taking care of our bodies. That shouldn't have to be a reality of the old man syndrome when you say I'm too old to do that, or whatever the case is. I think that mindset can get thrown out if we allow it to, at least.
Yeah. Yeah. Great point. And so this is where, if you look at your body right now, I'm just going to have everyone who's listening to this, no matter where you are, if you're driving, then don't go too crazy on this exercise, but just do a body scan and think about where you have areas of your body that could use a little bit of love, that could use a little bit of care, and don't let pain go too long. Just be completely unreasonable with any amount of pain, and start talking to it and start figuring out a way to work through the pain. And we've got pain experts here. We're going to have Dr. Amy Steinley, our doctor of nursing, come in and talk about some of the regenerative therapies. We'll get her on another show, but she does some phenomenal things. We've got great trainers like Nikki, Tristan. Sarah does some phenomenal acupuncture in the clinic. There's so many amazing things you can do, but do a quick body scan, see where you've got pain. Don't give the pain any more free rent. Think of it as something that you just want to let go of, because pain at the end of the day is resistance. And so where is the resistance in your body? And that could be a resistance in your flexibility, which will soon lead to pain. It can be a resistance in your mindset, to Kate's point. It's not doing the things that we need to do in life is where pain will manifest itself the most. And I love what Allison said. She said, I've learned not to put the word my before anything you want to get rid of, pain or anything else. So, because the pain is you don't want to own it. You just want to get rid of it. It's not something that we want to pack around with it, because pain can be very helpful. Obviously, it can let us know when there's a problem. But once you've identified the source of that problem, you've eliminated it, then you can move on. And I'll just finish with one quick story. This is actually Matt's sister-in-law, who's a patient of ours who it's so cool to see when people she was on her wit's end, almost suicidal, because her pain was so severe. Like, she just couldn't function. She couldn't work at the job that she was working, and finances were tight. And she ended up, my sister said, hey, you need to see these guys. And she came from out of state and came down and got treatments, and just slowly started getting better and better, started getting her body healthy. We said, it's an inside out job. We're going to be working on things from the outside, but you got to work it on the inside. And not only has she lost the weight that she wanted to lose, she's more confident, but her pain is almost gone. And this is where doctors were just trying to stuff more pain medications down her throat, and her brain was turning off. Her marriage was at risk, and now she's completely transformed. So no matter where you're at in life, there's a possibility for you to get so much healthier, so much better. And so I really appreciate you guys. So the challenge for the week is find the area where you've got pain and do something about it. Take action now. The sooner you can get on top of the pain, the faster it's going to be able to go away. The longer you wait, the harder it is to treat that. So that's the challenge for the week. Katie, Nikki, Kate, any last thoughts before we close things up?
Love it. Amazing content. Thank you, Regan, for coordinating this and getting these lovely ladies on here. And I think to your point, like, pain is optional, and let's make it optional.
And if you do have pain, we have resources. We are here for you. There's many things that we can do to help you.
Yeah, just like Allison said, East West is the best at treating pain. Thanks, Allison.
Thanks.
Absolutely. Nikki, what are your final thoughts?
I think that we really touched on some really important stuff, right? Everyone experiences pain in one way or another. So just knowing that there's options out there, that you don't have to suffer in silence and let it affect everything about your life, is just kind of heartfelt, right? We know that there's options, we know that there's resources, and even here at East West Health, it's our whole motto, right? We don't want to be in pain, we want longevity. So I think this was a really important topic to cover, and I think we touched on some really cool stuff.
Awesome. Well, thanks everybody. And if you have any pain in your body, don't hesitate to reach out to us. Go to acueastwest.com. If you have friends, family, loved ones who they're suffering, they don't need to anymore. Have them reach out. So thanks, you guys, and we'll see you next week.
Thanks, everybody.
Bye-bye.
Good night.